Hello everyone, my name is Jesse Hayes. I'm doing a PowerPoint or the Integrative Review presentation for depression, mostly in an outpatient setting. Okay, so first we're going to define the problem and establish the evidence for the problem. A lot of times depression is very, it's taken lightly. A lot of people, just kind of will tell you to get over it, or that, it'll pass, it'll blow over. So we do seem to kind of take it as harmless or situational at times. There is the SAD, the seasonal depressive disorder. Can be an extreme detriment to an individual's psyche and overall health. According to the Depression and Bipolar Support Alliance in 2016, it does affect approximately 14.8 million American adults in the United States, which is about 6.7% of our population. Of course, it is 18 or older per year, which is a substantial amount of people, which may be why a lot of people take it harmlessly. It is the cause of nearly 20,000 suicides in the U.S. per year, with diabetes and bipolar alliance. It can occur along with other medical conditions such as cancer, strokes, HIV and AIDS, Parkinson's disease. According to the Support Alliance, individuals are nearly 4 times more likely to develop a heart attack than those without a history of the illness. The World Health Organization does state that depression is the leading cause of disability worldwide, and that fewer than half those affected in the world receive treatment for it. So there is a substantial problem here, and the evidence is showing that we need to address some sort of intervention for this. So my goal is to improve in the rate of diagnosing and treating depression, and because then it will subsequently improve the physical health of an individual and impact the care provided by an advanced practice nurse. So with the literature review, we have our first study, which is Yon et al. In 2012. They performed a study on the recognition rates of postpartum depression for recent mothers. I believe the inclusion criteria was between 5 to 12 weeks postpartum. So in this study, they established a baseline depression rating using the PHQ-9, which is a 9-item list with the patient health questionnaire. It is pretty substantial for diagnosing and recognizing depression. So if these patients scored 10 or greater on it, they were said to have been expressing depressive symptoms and theoretically being diagnosed with depression. So they were immediately referred to either medication like antidepressant therapy, counseling, or a combination of the both once that score was established. And so the control group was not given the same tests. They also utilized the DAS-6, which is the Diet Adult Satisfaction Survey, and also the EPDS, which is the Edinburgh Postnatal Depression Scale, to establish anxiety and stress of these ladies. They found the result to be, upon that initial administration of the test, 197 patients were actually diagnosed with postpartum depression in the intervention group, as opposed to 78 of the control group. So there is a marked difference in having that routine testing as opposed to normal care. So continuing with the literature review, with the second study, Davidson and group, they performed a study with aged care facilities, and they hypothesized that if a targeted improvement involvement of increased staff training for depression screening would potentially improve recognition and treatment rates. This spans several aged facilities, included several hundred residents. They split them into 3 different groups. They had the Beyond Blue Depression Training Program in one group. A second group had the training program along with a screening protocol in place. So that once they did find someone to have depressive symptoms, they would immediately screen them and then from there refer them to a general physician for care. Then they had the control group, which was just usual care. The major limitation with this study was that everything was kind of banking on the nursing staff. So the trained nursing staff had their own clinical judgment to determine if they felt somebody was expressing depressive symptoms and should be referred. Not all the staff were trained. I believe only 43% were actually involved in this participation of the study. So they did not have 100% staff cooperation. But of those residents that were referred, 76% of them were in the training with protocol group, indicating that there was little increase in actual diagnosis rates with intervention groups versus control. This study does somewhat support the use of a screening or protocol for depression. So on to the synthesis of the literature. The first study, Yon et al., did find that routine screening at initial and annual checkups did increase diagnosis rates of depression. And that the PHQ-9, which is the main one they utilize, is a good start and valuable tool for depression recognition. The second study, Davidson 2013, did show that improved nursing staff knowledge, skill, and clinical judgment skills could potentially increase recognition rates of depressive symptoms. While this specifically does not aid an advanced practice nurse, having educated staff with you as an advanced practice nurse can increase patient care and outcomes. So utilizing increased staff training with screening protocols may identify symptoms sooner than later. So my proposed intervention is the incorporation of a routine screening test, such as the personal health questionnaire 9-item list. It does increase diagnosis rates and could lead to faster access to care, therapy, and management of your patients. Best outcomes for you would be reduced total symptom time. You'll have increased patient morale. You'll increase your patient report. You will also increase patients' quality of life. The most ideal location for this, I believe, would be an outpatient clinic or primary care provider's office. Inpatient setting could work, but with the routine and annual checkups, that would be ideal for this intervention. An outpatient clinic probably would be best. Thank you for joining my integrative review paper presentation and PowerPoint. Please leave a comment, and I hope you learned something.